My dad was on dialysis for like 30 years. 3 times 52 is 156 times a year. Times 30. 4,680 times, let's just say 10 grand. $46 million. How do we avoid dialysis? Tell us. How do we avoid it? What's the disconnect there? Like what's going on with that? Welcome. Another edition of Healthcare Stories, Healthcare with Healthcare Henry. And so this one is super important. I'Asiah's here. She is a social worker in the dialysis. So we're going to say kidney renal failure social worker or chronic renal disease, anything like that? Chronic renal. Okay.
Yeah.
And so we're bringing her here today, and we kind of want to just kind of go through, and, of course, this podcast is about education. So we want to learn about her and then also be able to educate the community on what she does and what we should be looking out for as all people of color, people of Americans, whatever you are, just trying to figure out how we can better take care of ourselves. So I'Asiah, welcome. It's perfect. Glad to have you.
Thank you, Henry. Healthcare Henry.
That's hilarious to me. However, so tell us a little bit about yourself, and then, we can kind of get a feel for who you are.
Okay, well, I'm a social worker, as you said. And I have been in the field of social work for, I want to say, maybe 10 years.
Oh, wow.
But I've, done a little bit of nonprofit. But as far as the medical field, I've been in the field for about a year now. And it's definitely a need.
Mm-hmm.
You see a lot. You see the gap in terms of people needing education on healthcare, their overall well-being. So it's definitely a field that requires a lot of servicing and a lot of education, a lot of pouring into people, empowering and encouraging. That's what I've learned in literally a year and a half now.
What does it take to be a social worker? Is that something that anyone can do? Is it how does that work?
Well, you definitely have to be someone who desires to serve the community.
Okay.
And what I mean when I say that is you have to love what you do. Being a social worker definitely requires you taking a lot of yourself to really support and help someone.
Mm-hmm.
When I was growing up, a social worker was somewhat tainted. I'm from New York originally, so when we thought about social workers, there was this stigma about a social worker taking away your kids. So when you grow older and you get educated, a social worker can do many different things, but ultimately is serving the community.
So when you say you have to care about serving the community, so I guess my real question is, how do you do it, right? So do you go to high school, college? Do you need a master's degree? Like, is this something that anyone can aspire to be, in your opinion, or is it something you have to have a college degree for? What is that? What does it look like?
Well, you definitely have to have a college degree.
Bachelor's.
Okay. I mean, there's different stages to it. So you can get a BSN and do some things, but there are limitations in terms of if you can work independently, if you can work in a hospital. Usually they're looking for a master's degree for any type of hospital work in a facility, outpatient, things of that nature.
Mm-hmm.
And to do therapy as a social worker, you're looking at a license. You have your LMSW, and then there's the LCSW.
Okay.
LCSW is specifically for clinical, so it's an independent license. You don't necessarily need it in terms of working in a healthcare field as it pertains to the hospital.
Mm-hmm.
But if you want to do something like therapy and building up your own business with clients and things of that nature, you do need a LCSW. It is a lot of schooling.
What's a lot?
Your bachelor's degree.
4 years.
4 years.
4 years of high school. How much a master's? How long is that?
Well, because I worked, my program was three years.
So your master's were 3 years.
Yes, and then you have to do an externship. So that means you're working and you're a part of some type of organization, getting real world experience.
You're not working for free, though.
Yes, you are.
So how long is that?
So 1 year, it's 1 full year. Well, it depends on the hours. And so I can't remember at the time how many hours I was doing. But you needed like a total of, I want to say almost, I can't remember, maybe about 1,000 plus.
Hours?
Yeah. Yep.
So you're basically broke for 8 years to get a job.
That's
No,
not true.
that's what you're saying, right? You're like, hey, I got to go to high school, I got to go to college, got to go to 3 years to get a master's and a whole nother year.
Mhm.
So this isn't just for anyone, because the average person, especially African Americans, like we can't
Yeah.
afford to just be broke for 8 years.
No.
So the average person, you need support from your family. How is it something that the average person can really get into? Like that's where
When you put it like that, oh my God. Well, I was fortunate enough to go to school. I went to Fordham University, so I also worked for Fordham University,
okay,
and I was able to get tuition reimbursement for that. So I really didn't have a lot of costs, and literally one of my externships was in middle school that was up the street, and we already had a relationship with the middle school, so it was an easy transition for me.
mm-hmm.
But it's all about determination. If this is something that you want to do, you have to be you have to be determined.
What is it that made you want to be a social worker? Something your child? Where are you from?
I'm from New York. I'm
You're
from Brooklyn, New York.
Okay, so I've only been to Manhattan.
Oh,
But I there are some good restaurants in Brooklyn that I hear about. I've just never been.
yeah.
But what in your childhood that you experienced made you say, I want to go into social work?
Let me think about that. Well, I'm originally from the projects or low income, however you want to um name it. And so my parents were very strict.
Wow.
And we didn't understand why, or at least I didn't understand why. But when you grow up in that type of environment, you see a lot of death, you see a lot of people don't make it. And when I say don't make it, they don't either make it out alive or
Go to jail.
they go to jail.
Yeah.
And I had mainly a lot of males that I knew who winded up dead before the age of 21. You know,
Jesus.
this is people I went to kindergarten,
Yeah.
middle school, elementary school with. And so my parents were very much like, this may seem overbearing, but it's for your greater good.
So that was like being in the house before the street lights came on.
Oh no, there was no being in the house before.
So there was no outside. Oh, Jesus. So you didn't even
no.
literally woke up, went to school, came back home, and
I was teased, my friends at the time, they teased me and were like, oh, you can't even come outside. And I was just like, dang, we can't go outside.
So you be honest. Is your mom gonna watch this? Probably.
I mean, I don't mind if she does. We've had these conversations.
Did you ever sneak outside?
No, I've not. We lived on a 10th floor. There was no sneaking outside.
Right.
No.
Whoops. Yeah. Okay.
Now,
okay.
If I can say that I have lied a little bit to hang out with people, and oh my gosh, I'll never forget that day. My mother threw a shoe at me.
Did it hit you?
No, thank you.
So you didn't get whippings growing up?
Oh, I didn't want to. I'm one of a lot of children. I'm the youngest, and so you kind of learn from their experiences.
Yeah.
That you just take it easy. Don't do what the older one did.
So you grew up, your family dynamic. Your parents were together?
Yes.
How many siblings do you have?
I have a blended family. I have 5 older brothers,
okay,
and then I have two additional siblings.
Okay, so how does it play out? Dad, mom, someone had kids before, they had kids together. How did it work?
My parents have 6 of us together. So yeah.
Okay. Mm-hmm. And you're the youngest?
I'm the youngest.
Are they super protective of you?
Yeah, my brothers are protective of me in their own way. My oldest brother is very much protective of me.
How much older is he?
He's 5.5, 6 years older.
So they popped them out back to back to back to back. Okay. Yeah. They were in love. They were in love. Mm-hmm. Well, that's when you look back at that, because you said you've been married before too, right? I think you said that off camera, but it's fine. Mm-hmm. So you've been married. Was that something that kind of said to you like, hey, I want to get married because I saw true love?
Well, yeah. Yes, it absolutely was. When you grow up in a dynamic with a 2-parent household.
Yeah.
And my father loves my mother. I mean, they equally love each other.
They're still married.
Yes. And my dad, the other day, I went to visit my family. My parents, they live in North Carolina now. And my mother came I'm talking to my dad and my brother, and my mother came in. And I'm looking at my father look at her. And he's just looking at her like,
that look.
Yeah.
Like, this is my wife.
Uh-huh.
That proud look.
Yeah.
I feel that. I love that. Yeah, I love that. Yeah.
Yeah.
Yeah, so. I got that. So what from that, right? So normally when I look at people in healthcare or social work, whatever it might be, there's always something that happened that drove them to want to do this. What was that for you?
Well, I wanted to become a therapist. I did a lot of transitions. I wanted to be a pediatrician at one point because I had a doctor who I just thought was really good to me, and I wanted to be a pediatrician. And then
We need
I
more
don't,
Black pediatricians, by the way.
huh?
We need more Black pediatricians.
Yes.
We definitely do. Like, to find one for my son, it's just been a struggle.
Oh,
Yeah,
really?
it's been a struggle. Yeah.
Oh, I didn't know
Yeah.
that. Okay.
Hmm.
Um, yeah, so I wanted to be a pediatrician at one point, and then I don't know how I got into psychology. I think I just fell in love with being able to understand the mind, how it works, what makes people think and feel and do the things that they do. And, my dad has always been just really, um, he and I always had like in-depth conversations about
Yeah.
the mind. He's very logical. I'm more emotional. So we would kind of just go back and forth.
That makes sense, though. That makes sense.
So that intrigued me. And then I kind of wanted to narrow my choices down. At some point, I was in my master's program and I was thinking about becoming a mental health counselor,
Hmm.
but I saw how limited it was.
Yeah, absolutely.
So limited. And I was like, no, I'm going to get my license. Psychology, it requires more schooling. I really didn't care too much for the research aspect of it. So I was like, no, I'm not going to do that. And then I was amongst social workers. God always works in such amazing ways because
Yeah.
He put me around my former coworker, who's one of my best friends now, and she had her license in social work. And then my supervisor at the time, she also was a social worker licensed. So I was like, maybe I should just take the social work route.
Yeah.
Did my research and saw that you can do so many different things within a social work field. And so that's how I got started.
So now you're in social work. You focus primarily on, would you call it renal failure, or and then what would you say that? Would it end stage renal? Like, what is it that you're actually focusing on?
Healthcare, being a healthcare advocate. I can't say that I didn't think I would land in medical social work. I thought I would always be in behavioral health.
Mm.
But again, this is where God comes in and He kind of aligns you where
Yeah.
you should be.
Yeah.
And being in the medical side of things and seeing that
Yeah.
it starts with the basic, what your basic needs are.
Hmm.
And if your basic needs are not met, how can you get therapy? You know what I mean? If you're not getting the resources for food, for clothing, for shelter, the last thing you really want to worry about, the last thing you want to concern yourself with is getting therapy.
Mm-hmm.
And therapy is not, it's more resources for therapy, and you can, they have co-pays and all these different things, but ultimately I see that the basic needs is most important.
That's funny that you say that, because when people talk about the disparities in America, especially, it's like they'll look at, oh, well, you people have the same opportunities we do. You go to the same schools that we can get to, right? And it's like, yeah, but you're not in class hungry. Right. Like, and so when you say that, that makes sense, because when they say Black men don't get therapy, that's the last thing on our minds. Like, if I come from the South Side of Chicago, right? And I've seen some things. I don't get into it too much, but I've seen some things. And I think that I don't know why we have so much built up anger and aggression growing up, because we fight a lot. We're very aggressive. But it is interesting when you think about it. Like, yeah, if you're hungry, why are you good at why are we good at basketball in Chicago? Like, if you really think about it, it's the outside of soccer, it's extremely cheap.
It's free.
It's free. Yeah. There's a goal outside.
Yeah.
We played in the snow. We played on the street. Like, if there was just like some space with 2 goals and the grass was growing, we play on that too. Right. That's all we could do. But if you were to tell us like that was our therapy, like that was what kind of helped us get through life, because it was so dramatic and so like brutally unfair, just, if you will, but unfair. do you ever go back to where you're from? You said you're from the projects.
Yeah.
And for those who don't know what the projects is, can you like explain briefly? No, seriously, you'd be surprised.
Yeah, you're right. I mean, because nowadays it's considered low income,
Yeah.
and that is so far from the actual reality. My in my experience, the projects is just it's a lot of people
Mhm.
on top of each other in a very small community, lacking resources, lacking I mean, and there's always a liquor store, there's always a corner store of people with people who don't look like us and
That own it.
that own
We
it.
got to break this down.
Yes, they don't look like us.
We got to get to the hair supply store, the beauty supply
The
stores.
beauty supply stores.
That's crazy.
A daycare center that's a part of the buildings
that we don't own.
That we don't own.
Now I'm gonna tell you something crazy. So they know I own a hospice, right? And I have been struggling with this for the longest. And maybe you can help me understand this because your field will help you better understand the psychology of folks.
Yeah.
There are Jewish-owned nursing homes in Atlanta. They bought them up like crazy. And so they basically said, unless you're a Jewish-owned hospice or home health or home care, you can't even get the business.
Oh.
We can't even get they don't even give their people choices, which is crazy. No, you don't get a choice. Like if you say that you want to come in on another hospice, and I'm gonna say this, and I'm gonna be honest with you because I don't care, they will make it so hard for you in there, you'll want to leave. Oh. It's insane. But where are we as a people? Like, what is it that gives us this crab in a barrel mentality that, from your perspective, where we can't actually figure out, like, hey, we should be working together, right? We should be circulating our dollars within our community to help build ourselves up. And when I say this, I don't just mean Black. I know people are going to be like, well, he's just like pro-Black. And it's like, yeah, well,
what's wrong with being pro-Black?
Well, I mean, being pro-Black does not mean anti-white, right? And I think that some people like look at it as anti-white. And even to that point, me and this damn Tesla, the Tesla's got to go. They're outside cleaning it now. The Tesla's got to go. It's got to go, man. I'm sad about it, but it just doesn't make sense. But what is that? Like, what is that in your opinion? Like, you grew up, we spend all the money, but we don't give it to ourselves. Because imagine if it came to our own people that own the businesses, how much they could pour back into our communities. But what is that? What is it that we have that doesn't allow us to understand that?
It's ancestral. It's, it's so much deeper. It goes deeper than coming together as a community. There's been so much systems that have caused us to somewhat compete against one another. And this has been going on for centuries, for years, and it's historical. When you pin us against each other in different ways, as it pertains to entertainment, as it pertains to school, the comparing and the comparison, opposed to encouraging, empowering, and uplifting. Those are things that we are not taught, and we haven't been taught that for a very, very long time. And so if this was something that we were taught, whether in our homes, whether within the community, things would change. And we definitely have to start to look at ourselves differently. We have to look at ourselves as royalty, as special, as purposeful individuals outside of society's identity of who we are.
Yeah.
And until we come to that understanding of who we are, and I'm always going to take things back to God because he's the creator of all things, we would be able to be more successful.
Yeah. So you talk about God a lot.
I do.
What's your religion?
I would say, if I had to categorize it, would be Christianity.
Okay, but you don't want to categorize it.
Well,
you said if I had to, right? That's a clear-cut sign that you're asking.
I believe in God. I don't believe in religion. I believe in relationship. I believe
spirituality.
Yeah, I mean, if we want to tag it as spirituality, yes, I do believe in Christ. I do believe in his purpose. I believe that he knew who he was, he knew who he came from, and he knew what he came here to do.
When you say Christ, doesn't that, I guess by default, you do have to believe in some religion because you use the term or the word that we use as Christians to describe our God, right? To be fair, I only believe in one God. I think there's one God. I think we got a bunch of different names for him, her, whatever you want to call it. But I think we're all talking about the same thing. And I think that to your previous point, like we're so busy trying to lead and be the next one on top, and we think our stuff is better than your stuff. In reality, it's the same stuff.
It
Yeah.
is. I mean, at the end of the day, we didn't make any of this.
Right.
I mean, yes, we are co-creators, but there is a creator
Yeah.
who established us and has given us the ability to establish things. And I mean, you can use science up and down as much as you want, but some things are just not explained.
When you talk about things not being explained, right? This is a huge topic, particularly for African Americans right now. We're talking about people who were born to essentially pay taxes and die.
Ugh.
Right. I mean, to be fair,
Yeah.
what is in your experience the fear of death, and what does it look like from the vantage point of African Americans or whoever? Right. I just want to understand from how you think, as someone who critically tries to understand how people think. Like, what is it that looks like? What is it that really is?
Personally, I don't have a fear of death. But I do have a fear of not fulfilling my purpose. And I do think that subconsciously, I won't say subconsciously, but unconsciously, most people fear death because it's the unknown.
Yeah.
And then some people don't even know what their purpose is. And so when death is knocking on your door and you're kind of like, oh my God, I didn't fulfill what it was that I was supposed to do. And now you have this window of time. I mean, we all are living in a window of time, but for patients who are on hospice or who were given a diagnosis, now it's like, oh my God, I only have a limited amount of time. Did I do the things that I was supposed to do?
Yeah.
All of these thoughts start to run through your mind.
Yeah.
And having been amongst dialysis patients, I do see that as a fear, even though they don't speak about it. Now, I do have some patients who are just like, look, I have accepted that this is my illness. I have accepted that this is a part of my life. It is what it is. But then you have some patients where it may come up in other ways. Denial, resentment, bitterness, frustration that they may take out on us or other, when I say us, the employees or what have you.
Yeah.
But a lot of that on a psychological level comes from the unknown. Like, oh my God, if I don't do this dialysis, I'm going to die.
So where's the clinic, the dialysis clinic that you work in? Where is it?
I don't work there anymore, but
I was going to say that big news.
And I mean, that's because I'm, moving on to,
can we say it? Boom, boom, boom.
Okay.
No. I won't say it. I'll let her say it. Do you want to tell them?
Sure. Yes, I'm going to the hospital. I'll be at Piedmont. So if you guys see me there, say hello.
Yeah, I'm happy to hear that for you.
Thank
I'm happy
you.
to hear that for you. Like, I think that's super exciting. I think that I love case managers. Obviously, I talk to you guys all day long. Like, you guys are the most beautiful people. And one of the things that I always struggle with, and I don't see how you guys do it, you go through the whole day hearing other people's problems. You got your own problems. You got your own life to deal with. You got crazy kids. You say you're married, you're divorced. Like, how do you do that? Like, what does that look like for you? What is it, self-care? What does that look like?
That's a loaded question. It looks like a lot of prayer, a lot of boundaries.
What does that mean?
That means saying no. That means having boundaries in terms of like, today I just need to lay down. Like if it's a Saturday.
Yeah.
And you know that I may have to clean the house. I might have to do all these errands, but physically and mentally, I'm just not there. I need to recharge my battery. I'm going to lay down. That means like, hey, I can't pour into a friend today. I'm going to just have to let them know. Can we, reschedule for another time? It's a lot of learning how to pour into yourself, how to put yourself first. And that putting yourself first ultimately is the most pertinent part of working in this type of field.
Do you end up with a lot of case managers like friends? Because because I'm asking, right? Because when I talk to people and it's like, I haven't responded in 2-3 weeks, like they don't get it, right? If you're not, because they're like, oh yeah, well you're outside. I'm like, no, I'm not. Like I have to go to work. And like, as you saw, since you've been here, like my phone rings 24. I just have to grab it and put it on silent because it's going to keep ringing until 2 a.m.
Oh.
It stops and it starts again at 6.
What?
It's
You don't
nonstop.
have do not disturb?
Nah, I can't. I can't do that because I got patients that need things,
Okay.
families that need things, and sometimes they'll call the office, but sometimes they'll call me personally. And who am I to not give them what they deserve, right? And so then it goes back to what, because I'm in therapy, what my therapist says is that you got to give yourself time to recharge, which is what is crazy because I can tell caregivers that all the time.
And you don't know how to do
I
it.
don't know how to do it. I don't know how to do it. I feel like if I'm not available for them, I'm doing them a disservice, and I don't want to do that.
Oh, that's guilt. But
Yeah.
that's something that you can't. I mean, when I say that's guilt, you're feeling guilty for taking care of yourself.
Well, I know why I have that problem though, right? Because I was asking you, like, what made you want to be case manager and things like that. I feel like no one was really there for my dad. I don't feel like he had a good case manager. Like I'll say that if I were to meet the person, you didn't do right by him, right? My dad, oddly enough, was on dialysis for like 30 years.
Wow.
30 years. And so he has his case manager who tells him at one point, my dad died. My story was crazy, but he died in January 2022. And so he's on dialysis for 30 years. And in 2011, he comes off of dialysis. Yeah, for like 6 months.
Oh.
Yeah, and so we're like, well, wait a minute.
Yeah, because they usually say you only have about 2 weeks.
At most 10 days, 14 days.
Yeah.
Right? So did he need dialysis? Like, what's going on? What changed?
Did anybody try to get him a kidney on a transplant?
We tried to do that. I couldn't do it. They said I couldn't do it. I used to box and all that stuff. So they just didn't think it was safe for me to give up a kidney for whatever reason.
Okay.
So I didn't do it. So he tried to get him a transplant. And then by the time we were able to actually find someone who wanted to do it, it was like he was too old. My dad and my mom were like 20 years apart.
Okay.
So my mother was 60, my dad was like 83 or something like that. Right. And then so, but I just feel like he never had a good case manager. I feel like they were never there for him. They never really were answering his questions. It was like he was like an unnoticed Black man.
Wow.
Pushed in a system. And then I started looking into, because when you get into the healthcare business, it's like, how much do you get paid for dialysis?
How much do you get paid for
dialysis? Yeah. How much is the treatment?
Oh, a lot of money.
It's a lot.
Gosh, I know it's in the 10,000.
It's 10 to 12,000 per treatment.
Oh Lord.
Yeah, my dad was 3 times a week for 30 years.
Did he have insurance?
Yeah, so somebody still paid somebody to go to dialysis 3 times a week for 30 years.
Imagine how much that is.
Let's not even imagine. Let's grab a calculator and try to figure it out, because 3 times 52 is 156 times a year.
Oh gosh.
Times 30. 4,680 times, let's just say 10 grand. $46 million. Yeah. So, like, unless my numbers are off, which I doubt.
So people, and this is where I get very passionate in terms of people taking care of themselves.
Yeah.
Educating. You have to educate
How
yourself.
do we avoid dialysis? Tell us. How do we avoid it?
You have to take care of yourself.
What does that mean?
That you have to eat. The way that people are eating now, it seems like, just based upon what I see on social media, it seems like people are becoming more conscious. But excessive, you really don't need to eat 3 meals a day.
Yeah, I eat 6 times a day.
Are they small meals?
Relatively small. I try to get about 5,000 to 6,000 calories in a day.
Okay. Now, are you eating fruits, vegetables?
I do have a smoothie or 2 a day.
Okay.
But I'm also a little bit bigger, like 200 pounds.
Okay.
So but I need to eat to keep that weight on, which I don't even know if it's even worth it and healthy anymore, because now my joints hurt sometimes. My knees, my ankles, it's like, I don't know.
Do you take vitamins?
Yeah,
supplements?
I take the 1 a day. I take Sure.
I'm sorry.
Ding ding. We need a endorsement. 1 a day. Centrum.
No. Okay. I'm not by any means an expert as it pertains to dietary, what the best dietary plan is for your body type or just your overall. But if you're not eating fruits and vegetables, if you're not drinking, and water has become totally different nowadays, you need to add like citrus. I add key limes to my water. And sometimes I'll tell dialysis patients, not all, because again, I'm not a dietitian or anything like that, but adding, because they are only able to drink a certain amount of fluids.
So add salt. You saying add salt?
No. No, God, they don't need any more salt.
That's what they keep saying. Like every time I turn on YouTube or Instagram, it's like salt to your water. I'm like,
yeah, but it's a certain type. So you want to get Himalayan sea salt, Himalayan salt or sea salt, and not for a dialysis patient.
Sure.
If it's a dialysis patient, you can add key limes because they get thirsty, and key limes is refreshing.
Is it like an electrolyte thing?
Yes.
Similar to like a natural Gatorade?
Yes.
That makes sense to me. So what about lemons?
I mean, yeah, lemons too.
I've never seen key limes in the store.
Oh, you can go to the farmer's market. Have you ever been to the DeKalb farmer's market?
No.
What?
No.
How long have you been living in Georgia?
I went to Morehouse in 2006.
Oh, you've been here long enough to have gone to seen the DeKalb market.
Is it expensive?
No.
Is it cheaper than Kroger?
Yes.
Seriously?
Yes. You get spices like around this size.
I don't cook.
But okay. Well, you can get a case of fruit. They have every kind of fruit that you can think of.
From the farmer's market.
Mm-hmm.
Yeah, I'll go. I'll do that.
You should. You need to go. Everybody needs to go to the farmer's market.
I don't know about everybody, but
yes,
try it out and see what you think.
Even start your own garden. Yes.
Really?
Yeah. My mother has her own garden, and it's like, I don't know, it's like a hydro, I don't know what to call it, but it's this real popular garden that you can do inside your house. Mm-hmm. And you can literally watch your vegetables and your fruit grow. My mother allowed me to taste, she had lettuce, she had kale, she had spinach, she had strawberries, she had tomatoes, and it tastes fresh. Mm-hmm. You can literally taste the difference.
Yeah.
Because you're growing it from your home.
Is that pure, truly organic? Is that what that is? Or do the seeds make it organic? Or because I don't know enough about this stuff.
Yeah, the seeds definitely. I mean, you want to get organic seeds.
Yeah. Okay. So eat better, exercise.
Yes, exercise. Even if I just started doing some running. I'm not there with the running.
Is that jogging?
Yeah.
Okay. Like,
walk a little bit, jog. Walk a little bit, jog. So
okay.
Started incorporating that.
You like you're in pretty good shape though, right? So you're not like.
I would say that's genetics.
Got you.
I don't mean to be. I'm just saying.
Gives you a better starting point though.
Yeah, my metabolism is it works quickly. So, yeah. But that's not to say that my back doesn't hurt sometimes. My body doesn't hurt. A lot of it is just movement.
Yeah.
Finding out, reducing stress. Reducing stress. Because stress is a killer.
Which takes us back to our other point. So a lot of African Americans are going to obviously have more stress than other people.
Yes, they are.
Yeah,
and with my patients, I would ask, like, how did you get here in terms of how did you get to dialysis? Because from my understanding and in my research and the teaching that I was taught about dialysis is predominantly, it's something you see within Caucasian men or what have you. Like it's more popular in Caucasian.
Dialysis.
Yeah.
And which is odd to me because African Americans to me have worse eating habits for the most part.
And that's the issue.
Yeah.
And high blood pressure.
High blood pressure. So if we can assume, right, because now I'm just curious here, if you're saying that most Caucasian men are on dialysis, but most African American men are the ones that need it, what's the disconnect there? Like what's going on with that?
The disconnect in our community is stress, is high blood pressure.
That's what puts us on dialysis.
Yes, high blood pressure, diabetes. Most of the male patients that I have had either juvenile diabetes or had high blood pressure.
Juvenile is 18 or below?
Yes, I had a patient who, my youngest patient was like 20, I think he's 23 now.
Yeah.
But, he was juvenile diabetes.
So 3 times a week he goes to dialysis.
3 times a week.
As a 23-year-old.
Yes, and God willing, he's on a transplant list. So
you should get it at that age, right?
Yeah.
We'd assume.
Right.
Okay. So now we know. So any advice for anybody that wants to get into social work?
Yes. If you are interested in social work.
Can they call you? Will you mentor them?
Um,
Can they email you? Can they just?
yes, they can email
What's your
me.
email address? Don't put your email address on here. Trust me, don't do that.
Okay. Well, it's peace and preparation the number one on one at gmail.com.
All right.
Yeah.
I told you.
I mean, I don't mind mentoring. It's just that I also have therapy patients, and I don't have a lot. I try to do that and not too much, but I do see some patients every 2 weeks. A couple of times out of the month,
Yeah.
providing therapy. So I do have somewhat of a packed schedule.
I got you. So, any just like two things to take away from that? What you've been as a social worker in kidney failure, more or less. What two things just to take away that we can all do to just kind of start today? Like, what can we do starting today to make it so that we get as far away from needing dialysis as possible?
Educate yourself in terms of health and well-being. That's most important. Learn your body. Learn how to eat healthy. Learn how to like fruits and vegetables.
Yeah.
Exercise, and ultimately stress. Learning how to reduce stress as much as possible.
I can appreciate this and that and everything that you brought, and I appreciate you coming on, and hopefully somebody learns something from it. Again, this is I'Asiah.
Derived from Aisha, but it's I'Asiah.
It is different. Yeah, it's different, but I love it. I appreciate it. Until next time, y'all. Again, this is Healthcare Stories with Healthcare Henry, and we love y'all. Peace.